So after saying that I wasn't ever going to go back to Veterans Health Administration and that I'd have to die before I go back, I ended up doing that and just going back unexpectedly. I was contacted by the mystery physician who I had identified on my own through my research out of the clear blue sky one day last Friday. And it was definitely a surprise call, to say the very least. Wasn't expecting it, and basically it is clearly because of the 50 million complaints that I filed. I feel like the ones that probably motivated this were probably the congressional complaints through my congressional reps. And I think I just got lucky that Tim Scott honestly was the main one where it actually mattered, because Tim Scott's office just seemed a lot more engaged than the other person that I contacted and filed a complaint through, quite frankly. And, you know, there was some negotiation that took place essentially over the phone to get me to go to this clinic. I hadn't been there before in Spartanburg, and I was really concerned because of the retaliation I experienced from this other licensee, that crap that was placed in my medical record that was false about me, and just the potential long-term implications of that. It was corrected. The retaliation was reversed, and the issue was corrected by the physician. And so that is now extinguished. The retaliation experienced at that Spartanburg VA clinic is extinguished. Like, that's done. So I don't have to worry about that anymore in not going to the Veterans Health Administration for medical care, because I'm so concerned about retaliation and like the implications of that long term. So that's great news. I've got to tell you, a real turnaround in how I've been treated, that's for sure. I went from no one giving a shit, quite frankly, about my health care and me getting health care and getting an appointment ever and getting any of my health care needs met, to a 180 of that. So thus far, like I brought a list, because I try to be organized. So I brought a list of what I needed. I had some things typed up as well to try to make it as simple as possible for everyone involved. And all that was tended to, essentially. And things were put in order so I could move forward quickly with medical care, and I did, because there's been months, plural, of delays with my health care. And for anyone following this, that you know that I'm planning on going outside the US for healthcare, already have, and was planning on doing a big, like, massive medical tourism trip because I had so many health needs unaddressed, essentially. And now I don't have to do that, so that's really good. And I'm still planning on going out of the country and getting some healthcare stuff. It's going to be minimal, I suspect, compared to what it would have been otherwise. Now that I'm actually getting some assistance finally. I'm right now at the Greenville, South Carolina. It's supposed to be a clinic, but I swear to God, this place looks like a miniature hospital. I'm in their parking lot right now, and I just got done with a couple other medical things that they had available here that they didn't at the Spartanburg clinic. So that went really good and smooth. One of the things I did notice, there's several things I noticed. Number one, had I not filed the complaints I filed, like, I would not be getting any assistance at all. That's very obvious to me. Number two, today I was at the Greenville, this like little mini hospital they call a clinic out here for veterans. Anyways, I was told basically for a medical service, let's just call it that, medical service, that they didn't have anything available till February. My mental clock already, because I'm on high alert at this point, knew that that's an illegal violation of itself, and that a veteran's supposed to be immediately offered community care referral if it does not fall within certain timelines. 20 days for primary care, 28 days for specialty care. On that 20th or 28th day, the veteran's supposed to be getting the care, okay? And I was not offered that. So I'm over here, like, literally, like, citing chapter and verse the law and the requirements. And then suddenly this person remembers that, oh, yeah, you're supposed to be offered community care. And they're like, what do you want that? I was like, yes, I do want that. Otherwise, I'm going to be waiting months and months and months for this simple medical thing. But the thing is, veterans aren't supposed to, by law, be required, or by policy be required to ask. It's supposed to be offered proactively when the staff sees that these numbers aren't going to be hit at a certain time. And didn't happen. And so I just flat out asked the staff member, I just said, are you being told by management to not offer veterans community care number one. Number two, because I followed up with another question after they answered that, because they answered no to the first one. I said, are you being asked by management, VA management, to not offer veterans community care unless the veteran asks for it proactively, like I just did and happens to know the law? And the person insisted no. If I just have a hard time believing their no, because like at the Spartanburg SC South Carolina VA clinic, like every person that was calling me, these people, I to this day don't know who they were because they weren't freely identifying themselves and whatnot. They never offered me community care despite telling me that there was a wait anywhere from over a month to 2.5 months for a basic primary care appointment to get me in. And my care even after that was delayed because they would cancel. And it's just total runaround, okay? Total racket. And the thing about competence is, in the US and what I've seen of people in the US, there is no way that anyone is this incompetent. This many people systematically doing the exact same thing. That's not incompetence. That's a pattern of behavior that is being directed by management, these administrators and Veterans Health Administration. And that is very intentional. And this is being done, I believe, to manipulate metrics so they can get more money out of the taxpayers, essentially. And that's the problem with a lot of US healthcare, is just flat out corruption, right? All this money floating around and no accountability, politicians being bought off basically by different industries. And then in the Veterans Health Administration, the administrators are making the bulk of the money while the providers are burning out and the patients are getting killed off. And this is what's happening. It's a big fat bureaucracy, big fat bloated bureaucracy. You know, patient advocates, women's health managers, and most of their administration could be completely fired, quite frankly, and some of them don't need to be replaced, like patient advocates and women's health managers. I know it sounds like a really important position, but it's not in these facilities. These people are just holding the party line, pushing paperwork at best, and at worst, they're, you know, like the women's health managers in particular. I worked with one of them on these facilities years ago. They were barely working. Okay, they're just collecting a check of about, I think it was like almost $70-something thousand at the time. I guarantee you that check is now probably $100,000+ for that women's health manager position. You know, there was another women's health manager position at a different facility. That person was not showing up to work at all. And I know because I was a patient trying to get a hold of them, and they had one excuse after the other, and they're collecting their check and all their benefits. And then, like, even in this state where I'm at, they try to give me the runaround and tell me a women's health manager again. And it's like, why? What are they going to do? You know, it's like a laughing matter. It's just fraud, waste, and abuse is what it is, in my opinion, with a lot of these positions that could be easily eliminated, that have nothing to do with veteran health care, that in fact interfere with veterans getting health care more often than not, adding to the layers of bureaucracy and the more demands for money that they're just sucking up. You know, I feel strongly for every dollar that goes to veterans health care, $9 more are going to these administrators and all these people who really don't need to be working there. The schedulers, these administrators can be replaced by computers quite easily right now. The technology is definitely there. Online scheduling is definitely a thing. It's been there, a thing for like 9 solid years in a very advanced level for patients. So you don't need this volume of people hanging around sucking off the taxpayers. It's just a fact. And so that's just really frustrating. And I know this isn't just happening to me. And, you know, for me, it's not sustainable to, as I get older, to be fighting at this level for some basic health care in this country, which is why it's so appealing to me, things like medical tourism and spending time outside the US to get medical care, because it's a lot more straightforward. It's a lot less bureaucratic. There's a lot less corruption, quite frankly, compared to what you're going to deal with in the US and the US government, with politicians being, you know, I just call it bought off basically by all these different industries, like pharmaceutical companies, pharmacy benefits managers, insurance companies. And then we also have the AFG union. That's another problem with Veterans Health Administration. I used to be a member of it, believe it or not, about 10 years ago before I quit working there. And after having a lot of time to reflect and writing my book, Veterans Affairs, Whistleblower Retaliation, my website, vanessaselect.com, you can find it. You know, I realized the AFG union, in my opinion, is just a part of the problem. It just adds another layer of dysfunction that should not be there. And if they could just get rid of that 100%, I think that would help a lot, because Veterans Health Administration is a very dysfunctional department, and is for sure a very self-serving department. It really is. And You know, when I worked there, it was a total nightmare. It's only gotten worse since I left, since I quit. I thank God I got the hell out of there. It was an awful couple years, me working at the Veterans Health Administration facilities. It's not a good culture at all inside of this organization. And that's it. So that's where it's at.